Well, hello, Stetson. I appreciate the opportunity to be here again today. I want to thank the leadership and Mr. President. Thank you very much for reaching out to spread the information that we have at the hospital level to your staff and students. Stetson has been an amazing partner throughout this pandemic, and I appreciate the opportunity to be here today. I have a list of questions that have come from students and staff, and I'm prepared to answer those for you here today. So question number one is, what is the COVID-19 Delta situation in hospitals and care centers in our community? Right now, the Delta variant of the COVID-19 virus represents the overwhelming majority of cases that we are seeing in the hospital system. Delta variant, if you are unaware, is a much more aggressive strain of the COVID virus than we have seen in the past. The Delta variant is producing a much more critical illness, a more respiratory illness in young adults. In fact, if I look at the patients who are hospitalized in our system, not just infected, but hospitalized, sick enough to be admitted to the hospital, even under these circumstances, the distribution among the age groups is roughly even between ages 18 and 64. Now, that's a big difference from what we saw before. So the situation I'm seeing is young people, just like you and me, who have been infected with this virus, who are so sick that they are ending up not only in the hospital, but in the ICU, on breathing machines, and even on heart-lung bypass. Unfortunately, we're even seeing people of your age group who do not survive this. So the situation right now is that we are at absolutely the limit of what we're able to do. We're having to stop providing some of the surgical care that we would normally provide. Illnesses like cancer surgeries are actually being delayed a few weeks so that we can care for the acutely ill, because our operating room staff are deployed taking care of COVID patients elsewhere in the hospital. So the situation right now is extremely tense. If I could characterize it, I would say that we cannot afford to be reckless right now. And that brings me right back into your second question, which is, what advice do I have for students returning to campus? Unequivocally, get yourself vaccinated. When we look at the data, we see that the overwhelming majority of patients who are hospitalized, and almost exclusively the patients who end up in the ICU level care or end up on a breathing machine or a heart-lung bypass machine, are unvaccinated. When we look at healthcare workers just within AdventHealth, of the employees who have been hospitalized, 98% are unvaccinated. So unequivocally, no questions, the safest thing you can do, the best advice I could give you, get yourself vaccinated and get your friends vaccinated. It is our best chance to not only quell this surge, but to stop future surges from decimating our healthcare system. The third question I've been asked to answer, and this one comes up a lot, is, are masks effective in lowering the transmission of the Delta variant? It's an excellent question. What you're going to see out there on the internet is a lot of people with an agenda, okay? And that agenda seems to be that they want to, for lack of better, no pun intended, they want to poke holes in the use of the masks. Masks have been shown to be effective in decreasing the spread of this virus, okay? Now, what you'll see on the internet is you'll see that people say, well, the viral particles are smaller than the pores of a mask. That's true, but the respiratory droplets that those viral particles are suspended in are not. And so what the mask does is the mask helps keep your exhaled breath, your cough, your sneeze. Nobody likes to think about it, but when you sneeze, you can fire particles across the room about 20 feet in half a second. So make sure you're washing your hands as well. You don't know where that keyboard's been. But what happens is those respiratory droplets are larger than those pores, and so they stick in the mask. And the mask helps keep all of that close to you, okay? It decreases your spreading of those particles around should you be either symptomatic or asymptomatically spreading this virus. Now, what they don't do, right, they don't afford the level of protection that we need if you're in close proximity, prolonged close proximity to somebody that's not wearing a mask. And that's why, again, doubly important, get yourselves vaccinated. I'm here to answer any questions. AdventHealth stands ready to answer your need for acute care, but what I'd really like to do is help all of you not come to see me in the hospital. And the best way that I can do that is by encouraging you all to get vaccinated. Thank you.